Hi friends, welcome back to allornonelaw. Today I'm going to talk briefly about differences between what you call left-sided heart failure and right-sided heart failure. That is a congestive heart failure. Okay guys, so before starting a discussion on this, I would request you to subscribe to our channel and please do share our videos with your friends. So I'm going to talk very briefly. These are the Usmle pearls. Okay, so let me go ahead and start this lecture. Guys, we have two things. As you know, this is left-sided heart failure. Okay, left-sided heart failure, HF, and we have right-sided heart failure. Okay, so I'm going to discuss briefly because this is a Usmle pearls, right? So this is really very important for your Usmle step examination, and this is a kind of rapid revision for your Usmle examinations. Okay guys, so let me start this. First, the things which are common on the left side and the right side are, one, we see the cardiomegaly. Okay, the cardiomegaly is also seen here in the right sided. Okay, so in the cardiomegaly, then we have what you call fatigue. Okay, then dyspnea. Okay, similar features can be seen in a right-sided failure, but the important things here, you should remember, the patient will come with fatigue. Look at the order I'm talking about: fatigue, dyspnea, okay, and what you call cardiomegaly. Okay, cardiomegaly. So here in the left sided, initially you get the cardiomegaly, fatigue, and the dyspnea, whereas in the right sided you get fatigue, dyspnea, and the cardiomegaly. Okay, so in the other differences in this what you call congestive heart failure from the left and right, we have the what you call S3 and S4 is heard, S3 and S4, and that is on the left side. Okay, and this is S3 and S4 on what you call on the right side. Okay, so very important is this, the location. You might hear S3 and S4, but you need to differentiate whether it's on the right side or the left side. Okay, so let me write here left and the right. Okay, so let's go ahead. Now the important points, like we see the cardiomegaly, right? So the chest x-ray, the chest x-ray, we see what you call cardiomegaly in the both. Okay, these are really what you call it's a similar features in the left sided and the right sided. Okay, so like cardiomegaly, we also see the curly B lines, pulmonary vascular congestion, and bilateral pleural effusion can be seen in the left-sided heart failure, whereas similar can be seen in the right-sided heart failure, but cardiomegaly is very important on chest X-ray. Then the other thing what we see here in a left-sided is the pulmonary congestion and the what you call pulmonary congestion. Okay, and rails can be seen. Rails can be heard, right? So here in a right-sided heart failure, you hear what you see pulmonary congestion. Okay, guys, you're getting. So there are a lot of similarities and there are a lot of and a few differences. Clinically, it's very difficult to differentiate, but you have some more points I'm going to discuss later, which will help you to differentiate whether it's a right or a left heart failure. Okay, guys. So now the important thing I'm going to talk about, that thing that differentiates from a left from right, is orthopnea. Very important is orthopnea. Okay, what is the orthopnea? Orthopnea is nothing but the patient he's short of breath when he's lying down. Okay, so the patients try to use more pillows so that his head is up the body, and it makes him comfortable to to breathe. Okay, so but in a right-sided heart failure, the most important feature, clinical feature, is gonna be what you call peripheral edema. The what you call edema of the lower limbs, peripheral edema. Definitely, this is the most important clinical feature. Okay, so now the other differences. This is left, this is right. Okay, So the other differences in our left-sided, you see paroxysmal nocturnal dyspnea. Paroxysmal nocturnal dyspnea. Okay. Whereas in a right-sided heart failure, you see JVD, jugular venous distension. Okay. So this is very important feature I'm talking about. Here you see paroxysmal nocturnal dyspnea, and here in the right-sided heart failure you see JVD. Okay. Then on EKG of a left-sided heart failure, you see ventricular hypertrophy. Ventricular hypertrophy. It could be due to the hypertension, could be the cause, or depending on the cause. Okay. So you see ventricular hypertrophy on EKG, whereas on right-sided heart failure, because it's related to the congestion, so you feel on examination of the abdomen, you feel hepatomegaly. Okay, hepatomegaly, very important, hepatomegaly, and ascites could be seen. Even what you call, you can see what you call esophageal varices. Okay, so these are the important features we have discussed here. So I think this is a very short video. Try to watch this video again. Okay guys, so thank you so much for watching this video. Take care.